I am here with epidemiologist Bonny Specker, who is going to give us an update of the COVID-19 situation across our state, our region, across the nation, and across the world, and also talk to us a little bit today about the rankings across the United States. Bonny, what do you have for us today?
Thanks, Chelsea. Last week we talked about where South Dakota ranked nationally, at least in the report that goes out every week that you post on the city website. And I thought this week it would be interesting to see where the United States actually compares to other countries. And so we'll be doing that today. And I just want people to realize that it's hard, I think, to compare countries internationally because there's issues with reporting. Like some countries, it's harder to get the data to a central location as rapidly as you might be able to in the United States. The systems, the health systems may be set up differently. So there are a lot of caveats with these rankings. Another issue is the age distribution within a country. If you have a really young country, you wouldn't expect as many deaths as you might see in a country that has a lot of older people. But it's still interesting, I thought, to see where the United States lies. So there's over 200 countries. I think there's 205 that the World Health Organization monitors. And the United States actually ranks 33rd in terms of the highest number of daily cases in the last 7 days. And I've used some comparisons here, so I'll be comparing the United States with Germany, Norway, and Britain, because I thought that sort of gave kind of a range of more developed countries that people are familiar with. And again, we have a lot of German ancestry and Norwegian ancestry in this part of the country, and then also British or English. So I just thought it would be interesting to see how we compare there. But the United States this past week, this is as of yesterday morning, that had 160 cases per day per 100,000 population. Germany, on the other hand, had 61 and Norway had 57, so they're doing much better than the United States. Britain, however, had 338 new cases per day per 100,000 population. The West Bank and Gaza, that's one combined area, was actually the highest with 752 per 100,000. And then I wanted to see what countries were around the United States, like who were we similar to? And Costa Rica and Malaysia both were the two countries above us, and Grenada and Belarus were the countries below us. So not in with what you would consider the more developed countries, the Germany, the Scandinavian countries, Britain, France, whatever. If you look at the total number of cases since this pandemic began, the United States is the 10th highest in the world. We've had 13,530 cases per 100,000. If you look at Germany, it's about 5,000. Norway's less than 4,000, and Britain is around 12,000. So we're doing a lot worse than Germany and Norway, and closer to what Great Britain's been doing. Montenegro is the highest with 21,000. And the US, Slovenia, and Israel are right above us, and Lithuania and Luxembourg are the two countries right below us. If you look at deaths, in the past 7 days, we're the 31st highest reported number of deaths. We've had 3.1 deaths per day per 100,000 population. Germany and Norway, again, doing much better at 0.4 and 0.2 deaths, and Britain even doing better at 1 death per day per 100,000 population. Grenada is the highest at 16 deaths per day per 100,000. And Latvia and Mongolia are right above us, and Albania and Cuba are right below us. So we're kind of in between these other countries. Overall, we're the 19th highest number of deaths per 100,000 population, 218 total deaths per 100,000 population. Germany is at 114, Norway is at 16, and Britain is at 207. Peru's the highest at 614, and the United States is actually, we're tied with Italy for that 19th spot. And Mexico and Slovenia are right above us, and Croatia and Tunisia are right below us. Now, if you look at vaccines and you think the United States probably has more vaccines available than a lot of these countries. I know that many countries are trying to get hold of vaccine, but we have a large supply of it. But we only rank 43rd as far as the highest percentage of people fully vaccinated. So in the US, we have 56.5% of the population fully vaccinated. Germany's at 65%, Norway's at 69%, and Britain is at 67%. All those countries are quite a bit higher than the United States. Malta, it's a small country. It actually has the highest percentage of fully vaccinated people at 96%. So we lie between Ecuador and Sri Lanka, just above us, and Chechnya and Turkey right below us in terms of the percentage of the population that's fully vaccinated. I thought these results were pretty eye-opening because for being what a lot of people would say a superpower or one of the more developed countries in the world, we are looking much more similar to the underdeveloped countries in terms of the COVID data, which is sort of sad. As far as the weekly summary, this is data as of October 13th, and I just want to note that this week's data doesn't include data reported to the Department of Health on Tuesday. So the dashboard each day contains data reported through 1 p.m. the day before. So we're missing about a half a day's worth of data from the state and the Brookings County data for this week. So it'll be interesting to actually see what the numbers look like today, because it will be a day and a half worth of data. But if we ignore that for now, that'll kind of balance out next week. What we are looking actually pretty good. This is Brookings, and we're continuing to go down. This past week, we had 47 new cases compared to 63 the week before, and it's pretty equally spread. There's probably more, 64% between that 20 and 59-year age group. 25% of the cases were less than 20 years of age, but only 11% were in that 60 years and older. So that's good. If you look at hospitalizations and deaths, we didn't have any this past week. So that's good to report. We had 5 new hospitalizations last week, and we also had a death last week for Brookings County. So we're at 0 for this week. If you look at the state data, it's also starting to go down, or continues to go down. We had 2,342 cases last week compared to close to 2,500 cases the week before. So a slight decrease. And here that's much more evenly spread throughout the different ages. 24% of the cases in South Dakota last week were less than 20 years of age. 30% were 20 to 39. 24% were in that 40 to 59 age group, and 22% were 60 years or older. This graph just still, I think, is interesting. This is the hospitalization data for South Dakota. We have gone down. The number of People hospitalized yesterday was 207. Last week it was 221. And only the number in the ICU also dropped, was 60 as of yesterday and 66 the week before. We had 115 new admissions last week compared to 136 the week before. Now, the thing that just seems odd to me, you can see this blue and yellow line. You know, it pretty much tracks on top of each other. The yellow line is referring over to this axis. It's the number of individuals currently in the ICU, whereas the blue line is over here. This is the number of people currently hospitalized. But you can see this large separation between the blue line and the yellow line that didn't exist prior to September, you know, where they're running kind of on top of each other. And to me, this is saying that the people that are in the hospital are sicker. You know, the higher percentage of them are in the ICU. So just throw that out there. Deaths last week also are down. We had 10 reported deaths showing up on the dashboard. And again, this is through the early October, but it's compared to 34 the week before. So we had a large drop there, which looks actually a little odd to me. And I'm thinking this might be part of the long weekend delay of reporting, because you wouldn't really expect it to drop so dramatically in 1 week. You know, it may go up to, you would expect something like this coming down on this side. The age distribution this past week, one of the deaths was among a 20 to 39-year-old, one among a 40 to 59-year-old, and 8 of them were 60 years and older. As far as the United States, you know, we have this nice decline that's happening since towards the end of September. We had about 650,000 cases last week compared to 726,000 the week before. So hopefully this continues to decrease. We are a little bit behind Britain. If you look at the British data, they have a very similar pattern with these curves, and they're further out in this area. You know, we've been lagging by about a month from what happened with them. And what's happened there is that they've actually plateaued at a pretty high level. So hopefully here in the US will continue to decrease. If you look at deaths, we're starting to see that a continuous decrease here. Again, the deaths lag the cases. So the peak is a little bit later for deaths than it was in cases for this current wave, but we are seeing a decline where we have close to 13,000 deaths this past week compared to a little bit over 13,000 the week before. In terms of globally, there are about 3 million new cases this past week and 3 million the week before. It is dropping a little, really 2.9 million. So this is good to see. We need it down more in this area. So we're getting there. If you look at the global deaths, we're having about 50,000 deaths this past week, and compared to 52,000 deaths the week before. But you see this nice steady decline in the number of deaths over the last 2 months. To summarize, take care of yourself and each other and have a good couple of weeks, and we'll be back next week.
See you in a couple weeks.